Our bodies know how to heal in most cases, without a lot of external stuff. When you get a cut, your body, you don't have to apply anything to it. It just scabs over, the blood clots, it scabs over, and it just heals. And this is like a giant, deep cut. But guess what? It'll heal. You want to get the okay and the clearance from the doctor before you put anything on that incision for any reason whatsoever. Will my dog be sent home wearing a bandage or a plaster? Some dogs are sent home wearing a long modified Robert Jones bandage, and usually this is the lateral suture dogs. And the reason for that bandage is that it prohibits the dog from having excessive motion in the leg. It also helps to keep swelling down. So you'll want to know when that bandage will be taken off. Now, if we're talking about just a localized little bandage or plaster over the top of the incision, then you want to know when that will come off and when it starts coming off, because what usually happens is these things start peeling off and then they're hanging off and freaking the dog out. Some dogs are afraid of the bandage. Some dogs they want to lick it. I'm sure it probably itches and bothers them. The question to ask the doctor is then, well, how do I take off the remaining piece of the bandage? I'm hoping the surgeon does not say, rip it off fast like a Band-Aid. The reason I say that is because the skin that has been shaven is it's swollen, it's painful all around that incision. And so if you have ever had a surgery, and I have, that you have a big incision, if you put any kind of adhesive near it and then quickly rip it off, then it's going to pull on that incision and it is going to hurt a lot. I'm trying to not say the HE double hockey sticks word. It's going to hurt. Don't rip it off. Have some patience and ask the doctor, what can I use to slowly take off the bandage? You don't need to ask the doctor this, because I have seen this in Facebook groups where people say, I dipped a Q-tip in nail polish remover, people said this, and I dab it on the adhesive and I slowly peel the bandage off. I hate that. There should not be nail polish remover near your dog's incision. Other things people use: Goo Gone, engine starter fluid. Yeah, nuts. And because I guess there's ether in it, so somebody's vet told them they could use engine starter fluid. I can't even believe it. If you were in the hospital, would a doctor or a nurse come in and use engine starter fluid to take off your bandage adhesive? No. So don't you use it. This is where I override what a vet might say. Don't use toxic stuff on your dog's bandage. My gosh, I'm like going off on a wicked tangent. Here's what you can use, and just make sure the doc says it's okay. A Q-tip dipped in coconut oil, and then you look where the bandage is stuck to the leg, and you slowly peel that back, and you take the Q-tip and you dab it and you peel it. Very slowly, keep working it. Your dog might freak out, so do a little at a time. Another thing that works is olive oil. Any kind of natural oil will work without being toxic. End of rant. Can you explain what a seroma is, and what do I do if my dog develops one? A seroma is an empty, fluid-filled space beneath the surface of your dog's skin. These sometimes happen very close to incisions. They fill up and they look like a jiggly water balloon. Some doctors will say they want you to use a warm compress, which is just like a washcloth dipped in warm water and then wrung out, and you can just apply it to the dog's leg. And some doctors just say, don't worry about it, the fluid will get resorbed and you don't really have to do much about it. These usually are not that painful, they're mostly just kind of gross looking. Here's an important one. What signs do I look for that would suggest infection? With this one, I don't even want to answer it, because I want you to really listen to the doctor when he or she explains this. You need to know what the beginning stages of infection look like, and then what the later stages look like. If your dog does develop one of these signs that suggest infection, how quickly should you get the dog to the surgeon to be checked? Do you need to get a new antibiotic? And then the next question will be, will you culture the dog's incision or anything that's draining. This is important because some antibiotics are good for certain bacterial strains, but not others. If an infection starts, you want to know which bacteria are present. They can't do it unless they swab the area and then put it on a little petri dish and grow it. And then they'll say, okay, this bacteria is present. We need to switch up your antibiotic because that one's not effective against that bacteria. Okay, so infection signs, and then what do we do about it if an infection starts? And will you do a culture? How many days after surgery should I continue giving pain medication? Now this one, guys, is kind of all over the board, where some doctors like to go for about 2 weeks giving pain medication and others are less. Remember, please remember that this is a big surgery. So even if your dog seems like they're doing okay, you're not the doctor. It's not your job to decide to stop pain medication because you think they're okay. If somebody sawed into your leg bone and you had to walk on it, I think you would want pain medication. I feel a little sorry for these dogs whose people stop pain meds 2 or 3 days post-op. I just don't think it's right. Please talk to the doctor about this. Is it okay to stop doing passive range of motion or PROM, or skip using the ice pack if my dog hates it? So some people are using a guide that will talk about post-op physical therapy. And one of the things that they mention doing, and maybe even your doctor's discharge instructions say that they want you to bend and straighten your dog's leg, only some dogs hate it. You've got to know what the doctor will have to say. Should I continue doing it? Can you show me how this is supposed to be done? How far should I bend it? How straight should I make it go when I extend the leg? You want to know that so that you're not wondering about it when you get home. A lot of times doctors will say if your dog hates it, you can skip it. Don't forget, your dog will be moving around. You're going to be taking them out to pee and poop. And so instead of passive range of motion, which means you're doing the movement for them, walking and moving around is called AROM, and that's beneficial because walking helps to restore muscle mass and make it stronger again, but it also helps to reduce inflammation. You don't always have to do passive range of motion. If your dog is going to be fighting you and really holding their leg back, then it might not be worth it to do. So ask the doctor what they have to say about that. How much arthritis does my dog have? Now this is where hopefully the doctor will go over x-rays with you. In most cases, it's only the surgeon who can go over x-rays. A vet tech cannot do that. You might ask ahead of time, will you please show me my dog's x-rays? And when they do that, I'd like you to get pictures using your cell phone of all the different x-ray angles, so each of the pictures that they show you, and then have them point out how much arthritis is there, just so you know. What is a meniscal release, and will my dog have that done? A meniscal release, when we say meniscal, I'm referring to the meniscus, which there are 2 of them in your dog's knee, and that is the little cartilage that separates. It sits on top of the tibia, which is the bone at the bottom of your dog's leg. And it's one of the bones at the bottom of your dog's leg, the other is the fibula. And so the tibia has these 2 cartilages on it. And sometimes not only does the dog have a CCL tear, but they might also have a torn meniscus. If you've ever heard about somebody saying that their dog's knee is clicking, lots of times it can be a meniscal problem. So ask about whether the doctor will do a meniscal release at the time of your dog's surgery. Does my dog have patellar luxation? And if so, what will you do during surgery to correct that? My dog had this, and what she had to do, this was on one of his knees, and so patellar luxation is where there is a little groove that the patellar tendon is supposed to sit in. How do I describe this? So this would be the groove in the dog's bone, and then this would be the patellar tendon. It's supposed to sit in that groove. When a dog has patellar luxation, the patellar tendon slips out of the groove and their actual kneecap has too much play and it shifts either medially or laterally. Medials toward the midline of the body, laterals toward the outside of the body. When the dog's kneecap shifts, you might hear a pop, and see your dog like skip a couple steps, that hurts them. You want to have patellar luxation corrected at the time of your dog's surgery. And so what they do is, if the patellar groove is not very deep, the surgeon makes a deeper cut so that patellar tendon can kind of sit in there. It can kind of be held in there, and sometimes they put a couple little sutures in place so that the patella tracks correctly and doesn't have a tendency to slip and slide either left or right.